Hi everyone, I am Jocelyn Potente. We are going to talk about fetal alcohol syndrome.
But first, what is genetic disorder? Genetic disorder is inherited medical condition caused by a DNA abnormality. As we unlock the secrets of the human genome, the complete set of human genes, we are learning that nearly all diseases have a genetic component. Some diseases are caused by mutations that are inherited from the parents and are present in an individual at birth, like sickle cell disease. Other diseases are caused by acquired mutation in a gene or group of genes that occur during a person's life. Such mutations are not inherited from parents but occur either randomly or due to some environmental exposure, such as cigarette smoke. These include many cancers as well some forms of neurofibromatosis.
Let's move on to our main topic, fetal alcohol syndrome, and watch the presentation that I prepared.
Fetal alcohol syndrome, or FAS, is a condition in a child that results from alcohol exposure during mother's pregnancy. Currently, the leading cause of intellectual disability and can cause characteristic physical abnormalities. Normally, the fetus is connected to the placenta by the umbilical cord, so the fetus gets the oxygen and nutrients from the mother. Unfortunately, ethanol and toxic alcohol metabolites like acetaldehyde also pass freely to the placenta. But the fetal liver doesn't have the necessary enzymes to metabolize them, so they build up to the fetus really fast. In FAS, ethanol interferes with cell division, proliferation, cell growth, and differentiation. In migration of mature cells to their final location in the developing embryo, which affect the development of various fetal tissues including the brain. Alcohol-induced brain damage includes partial or complete agenesis of corpus callosum, which links the two hemispheres together. So, either it forms completely or not at all. This causes intellectual disability and seizures when frontal cortex and hippocampus are affected. This causes poor memory and communication skills as well as intellectual disability. The cerebellum can also be smaller in size, called cerebellar hypoplasia, leading to trouble with movement and balance. The most common symptom of FAS is growth retardation resulting in low height and weight. Microcephaly can also occur, which results from an overall decrease in brain growth. Children with FAS may also have certain facial characteristics like small, palpebral features, which is a reduced distance between the two sides of an eye, smooth or flat philtrum, and thin vermilion border, which is the border of the lip. Other features include limb dislocation and heart defects. Now, there is no specific blood test or brain scan to detect the FAS. The disorder is suspect based on characteristic symptoms and maternal history of alcohol consumption during pregnancy. Unfortunately, individuals with FAS experience brain damage due to ethanol toxicity is permanent. So, treatment focuses on the management of symptoms of the disease through personalized educational program for children with trouble learning, behavioral interventions for children with difficulties in communication, and anti-seizure medicines. So let's have a little recap. The FAS is a condition in a child that results from alcohol exposure during mother's pregnancy. The symptoms are growth retardation, intellectual disability, craniofacial defects, limb dislocation, and heart defects. And the treatment is the management of symptoms. And that's all.
After watching the presentation, we have an idea about its causes, symptoms, and treatment. For more information, I prepare some documentation or interview about this alcohol syndrome. Now, let's watch.
I always judged people like me. Growing up, I thought a woman who drank while she was pregnant was just about the worst kind of monster there was. Hey Nat, we have to stay away from the camera, okay? It's just gonna look at you.
Natalie, what's it like to be you?
I'm 6. Are you ready?
I'm ready. Are you ready?
Yeah.
What do you want to tell everyone?
I want to tell dinosaurs.
All right, tell them about dinosaurs.
Because I like the long necks.
Before Natalie came into my life, I was a mess and I was drinking on a daily basis, and she was born at 28 weeks, so about 3 months early.
What's the best thing about Natalie?
She's the best sister I've ever had.
I was planning on giving her up for adoption because I couldn't take care of myself, so I certainly couldn't be responsible for taking care of somebody else.
What's your favorite thing about dinosaurs?
The Tyrannosaurus Rex.
What does he say?
Since the day she was born, that idea was never spoken of within my family. Like, we never revisited that subject.
We feel like we're friends, not sisters. But we're sisters. And Natalie's.
She was in the NICU for 3 months from when she was born, and so during the first month I went back to rehab.
If you could tell the whole world one thing, what would it be?
I'm a horse.
You're a horse?
Yeah.
Every day I'm grateful to be alive. She saved my life. And then her sister came along and we just became a fun little family.
La 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 la.
So you have your eldest daughter, Neve. You adopted her when she was 6.
No, we didn't. We adopted her when she was a baby.
Oh, okay.
It was when she was about 5 or 6 that we discovered she'd got fetal alcohol syndrome.
Right.
Because she was so young when she came to us, we knew she'd got, she was delayed in her development. But that's quite normal for children that have come out of the care system. They've not had a great start in life. So everybody thought it would be something that she would grow out of and she would be fine.
So what were the initial signs?
Like a lot of children, it was when she started going to playgroups and nurseries and she started being alongside other children. So it was things like she struggled to pay attention. Kids with FASD struggle with their fine motor skills, so it's stuff like holding a pencil. All the other kids could hold a pencil and draw or scribble, and she was struggling with things like that. She wouldn't stay focused on a task. She'd flit around the room and play alongside the other children rather than with them. So they were sat listening to the teacher read a story and she was in the corner, in the cooking corner, in her own world.
So how long was it before you realised what it was?
When she was 3 and in nursery and playgroups, and people started saying to us things like, we can't meet her additional needs, and we're thinking, what are they talking about? So we went to our GP who referred us to community paediatrics, and it took 2 years. And we actually finally ended up at Guy's and St Thomas's Hospital at the genetics department, and she has got the facial features of FAS, which are very, they're most apparent when children are younger. As you grow older, the facial features can grow out. And so that's how she was diagnosed.
So
Once again, this is Jocelyn Mutante, and that's end my presentation.